This is Sayyida Farhan, wife of
समरी में नाम बता दो. Abbreviation काफी है. Mrs. SI is good enough. लेकिन मैंने उसको क्यों फेस किया? There was a reason. I said कि मैंने उसको फेस कर दिया. Why was it? मैंने उसको इसलिए फेस किया, मैसेज नहीं बताया. So during your examination, you are going to name the patient and you are going to put Mrs. or Miss or whatever I will take. Okay. So for any station, this is the most important information. Teacher, summarize. Mrs. SF.
Mrs. SF, primary gravida.
Which told me to.
Married for 1 year.
It's an age important.
Age is very, very important. Mrs. SF, 29 years of age, married for 1 year, primary gravida, at 3 weeks of gestation, presented to us with increased blood pressure, known case of gestational diabetes, presented to us with increased blood pressure of 160 by 110 for about 1 day with blurring of vision.
Okay. Somebody else can do it for me. Volunteer take. कौन करेगा? सेवेटर. तो पोस्टी और फिर कुछ करेंगे क्या? मैं 3 सिनेरियो कर रहा हूँ. सेकंड ईयर कौन था?
Mrs. Esther, 9 years of age, resident of Pajamana. She's married to 1 year. She's a primary doctor. The request of March 2022, 7th of January 2023. She was diagnosed with gestation.
तो तुम तो सिर्फ पढ़ रहे थे. उसकी समरी देख सकते. You are just reading the whole thing. So I will do it for you. Mrs. SF, 29-year-old, married 1 year, primary gravida, at 33 weeks of gestation, presented with blood pressure of 160/110 and blurring of vision. She's been diagnosed diabetes in pregnancy. Many gestation diabetes बोला इसकी वजह से. You tell me, how do you diagnose gestation diabetes? The first I'm going to ask a few questions, then we will see. So how do you diagnose diabetes? Is this gestational diabetes or is this patient a non-diabetic? How would you?
We get a GT done at 24 weeks.
But she was diagnosed at 19 weeks. So my question arises, was she diagnosed by a GTT or she's a non-diabetic?
Might be a non-diabetic in this case, but if there is a history of diabetes mellitus in family, then we get the GTT done earlier in 16 weeks as well.
No. In primary gravida, we always get the GTT done at 24 to 26. So my question is, why was this diagnosed at 19 weeks? Either there was something going on because of which it was diagnosed, or it was diagnosed on a routine blood sugar evaluation. ऐसी बात है. So it could have been pre-existing diabetes as well. So my question is, how would you differentiate at this stage whether it is pre-existing diabetes or has it happened some otherwise? The voice is low. Okay, we'll speak up. इसमें देखें कि volume ऊंचा हो सकता है. Is it better now? अब आपको
कैमरे के करीब आ जाएं पार्टिसिपेंट जिन्होंने डिस्कस करना है ना, तो आवाज थोड़ा अच्छी हो जाएगी.
मेरी आवाज आ रही है?
जी मैम, आपकी आवाज काफी बेहतर है.
यस मैम.
पार्टिसिपेंट की आवाज में पता है टेंशन में वैसे ही कम हो जाती है. माइक का मुंह अपनी तरफ कर दो. Okay, so what we have done so far, we are sharing a scenario with you.
इधर आओ. मोबाइल किधर है फुफ्फो वाला?
अब मोबाइल अपने साइलेंट पे कर दो. So we are discussing a case with you. The patient is Mrs. SF, 29-year-old primary gravida, who is at 33 weeks of gestation, presenting in emergency with a blood pressure of 160/110 and blurring of vision for a day, and she has been diagnosed with diabetes during pregnancy at 19 weeks. So we were discussing how would we know at 19 weeks whether it is gestational diabetes or it is pre-existing diabetes. So candidate, आप बताइए.
To OGTT,
जवाब देना तो आ गया. So when is normally OGTT done?
Ma'am, at 24.
At 24 to 26 weeks. So my question is that this is a patient in whom diabetes was diagnosed as early as 19 weeks. So what are the investigations which will help you decide whether it is gestational diabetes or pre-existing diabetes?
HbA1c.
HbA1c is a good answer because if it were pre-existing diabetes, then HbA1c would be raised. If HbA1c is not raised, then it means that pregnancy, during the pregnancy, diabetes has happened. Okay, so this is the patient that you have blood pressure of 160, 110, having, actually it is not mentioned over here, but the patient was having regular antenatal visits. So how will you manage this patient? What do you want to do? You are my setting candidate, so you can come forward and sit with her. Aren't you? That's okay. The more you speak, the better you will become. It's to your advantage. G.
First of all, we'll counsel the patient about this scenario.
आप ये कुर्सी ले लो. ऊंचा बोलना माइक अपनी तरफ कर. टेबल भी फेंक सकती हो, कोई परेशानी नहीं.
She's a high risk patient because she has undergoing risk factors, that is blood pressure and diabetes. So we'll counsel her. Her age is 33 weeks. We'll counsel her about her.
Not her age, her
Sorry,
gestational
her
age.
gestational age is 33 weeks. We'll counsel her that.
So you
her
have
blood
found
pressure-
two problems in the patient. One problem is diabetes and the other problem is,
Blood pressure.
you will call it blood pressure या उसको भी label करोगी?
PH.
PIH till the time you don't find something else. Okay. Chalo, so the patient has got two issues which you want to resolve. What is the pressing issue at this time?
Blood pressure.
The high blood pressure.
And
So what will you do?
First of all, we'll try to bring it to the lower level, that is 140 to 90. That is much acceptable using the hydrogen.
पीछे हो जाए. चल अजीत ताकि.
Madam, hydrazine, we use it when the diastolic is 100. And at first, we will just call for help and try to bring the blood pressure back normal. Then we will send her investigations, all the PI profile.
Would you like to admit this patient to the
Yes,
hospital?
sir, definitely.
तो आपने वो तो बताया ही. सबसे इम्पोर्टेंट बात तो ये है कि ये पेशेंट इमरजेंसी में ऐसे डिमांड हो सकती है. You will need to admit this patient to the hospital. So you will admit her to the hospital. What
Blood
else?
pressure, and then we will start give her a loading dose of magnesium sulfate and also start maintenance. And we should keep a watch on her blood pressure and also the reflexes.
तसल्ली नहीं हुई. जी, मैं सेकंड ईयर.
First of all, we give her oral levetolol, and if it is not controlled, we can go for nifedipine, and if not suitable, the other option is methyl-dopa, and if
Okay, I have two questions for you. My first question for you is the patient has got a blood pressure of 160, 110, and she has got blurring of vision.
in this case, sorry, we'll give her hydralazine. As
Right.
her diastolic blood pressure is 110.
मैं तुम सबको फेल कर दे.
Levital.
What are the problems with the patient? Have you identified the problem?
Blurring of vision, headache.
If a patient comes to you at 33 weeks with a high blood pressure of 160, 110 and blurring of vision, what is your diagnosis?
Preeclampsia.
Right. Your diagnosis is impending eclampsia. So your diagnosis is imminent eclampsia or impending eclampsia. If the diagnosis is impending eclampsia, it is a obstetrical emergency. तो आप सबसे पहले तो एग्जामिनर को ये बताएंगे कि आपको बात समझ में आ रही है. If this is an obstetrical emergency, immediate risk factors have to be explained. One person will do counseling, a quick history, a quick examination, a review of investigation, and emergency management needs to be started. क्या मैं सही कह रही हूँ? Okay. अब आपने ये सारा कुछ कर लिया, उसके साथ आपने emergency management, we will do it one at a time. So what investigations do you want to send for this patient?
Urine protein levels, serum uric acid, her
मैं इसकी baseline कराऊंगी और मैं इसकी specific कराऊंगी. Baseline वही है, CBC, blood group NRH, urine routine examination, especially for protein, viral markers, hepatitis B, C, HIV, and What else?
LFTs and uric acid.
वो routine examination में नहीं, routine examination में इतना ही आएगा, इसके साथ आप उसका करवाओगे blood sugar evaluation. जो specific investigation है patient की, उसके अंदर आप करवाएंगे uric acid, liver function test, और आपने उधर से platelet भी कराने हैं CBC के साथ. Liver function test, and that's all that you need for specific investigation and an ultrasound, which should be done in the labor room, and review of the pre-existing ultrasound that is available. उसके अलावा कोई investigation करवानी है? हाँ, urinary lumen होगा, I agree. So your investigation, there's one more investigation I want you to get done. Sugar profile agreed. You should also do a fundoscopy.
Fundoscopy, madam.
Blurring of vision है. The only thing is that the fundoscopy is not an emergency investigation you can wait, but fundoscopy should be done. Why do you want to do fundoscopy?
Madam, this is the complication of the.
Fundoscopy के फर्क होते हैं, diabetic फर्क होते हैं, acute hypertension के फर्क होते हैं, chronic के फर्क होते हैं, ठीक है? So you are trying to assess. Okay, आपने investigation करा लिया. Now, what is it that you are going to tell the patient and her family in counseling? Rectal damage नहीं होता, इसके अंदर temporary change होता है pending eclampsia. Okay. What is the counseling that you want to do in the family and the patient?
We will try to explain them that if we are trying our best to bring down their blood pressure, but if there is any.
You will tell them the diagnosis.
Yeah. And
You will tell them that this seems like a pending eclampsia, which is an obstetrical emergency, and for that obstetrical emergency, you will need to admit and you will need to manage the patient. ठीक है? Fetal-maternal risk explain करना है जरूर करें, but पहले आपने उनको बताना है कि हम patient को admit करके उसकी management शुरू कर रहे हैं. And we will plan the mode of delivery of the baby once the blood pressure is under control and we are clear about the investigations and clear about the situation that is happening. About eclampsia, risk of CVA, maternal mortality, IUD, preterm birth, हाँ आप इनकी काउंसलिंग करेंगे, लेकिन आप उन्हें बोलेंगे कि पहले हम इमरजेंसी मैनेजमेंट करेंगे, उसके बाद we will see what is the plan for delivery of the baby. ये आपने कर लिया. Now what are you going to do immediately? Emergency measures इस patient के क्या है? Specific बात बतानी है, wait नहीं करना.
Initial sulfate loading.
किस तरह से loading का कोई मतलब नहीं है.
4 grams stat IV and followed
Madam,
by
first of all, stabilize the blood pressure and then magnesium sulfate.
1 gram per hour over 24 hours.
Excellent, excellent. So why are you giving magnesium sulfate?
Eclampsia.
Because you have diagnosed impending eclampsia. So in order to prevent an eclamptic fit, you are giving magnesium sulfate as an anticonvulsant. Is there any other role of magnesium sulfate in this particular condition? Because the baby is premature, you are going to give magnesium sulfate for
neuroprotection.
neuroprotection. Good. Okay. What else? So how will you control the blood pressure which is causing a problem?
I will Betalol.
Ma'am, IV hydrolysine.
So
is
we
the
have a
better-
choice of giving either hydrolysine or labetalol, whatever is available for you. So कैसे देंगे hydrolysine?
मैम पहले लेबिटालोल देंगे. लेबिटालोल 20 mg status in
Madam,
dilute.
hydrolysine 1 ampule is diluted in the 4 ml of normal saline and then give 1 cc IV to the patient every 15 minutes. We will check the blood pressure of the
Yes.
patient.
So hydrolysine tricky here because of the reason that hydrolysine can sometimes cause a sudden decrease in the blood pressure. So that is why with hydrolysine you have to monitor the blood pressure every 15 minutes. Labetalol injection can be given as a 20 milligram stat injection, but it has to be followed by follow-up क्या labetalol का? उसके बाद आप 10 milligram दे सकते हैं. Eldomate जिसने कहा मैं agree नहीं करती, because Eldomate if you are going to give it means you are waiting for 24 hours for the blood pressure to come down. This is a patient who has got impending eclampsia. In this, anything that you give for control of blood pressure has to be injectable. So oral medication का यहाँ कोई रोल नहीं, तो आपको injectable देना चाहिए. Okay, what are the other general measures that you're going to do in addition to the antihypertensive and anticonvulsant? What else should you have done?
Anesthesia free of evaluation.
नहीं, उससे पहले
Catheterize the urine output
Right,
to monitor.
catheterize the patient. Multidisciplinary team ठीक है, आप involve कर सकते हो, but इस वक्त emergency है, पहले अपने काम करो ना. Multidisciplinary team ज्यादातर आप उनमें involve करते हो जिसमें there is not a medical emergency. इस वक्त emergency है, इस वक्त मरीज आपकी है. You might involve MDT, like anesthetist को आप involve कर सकते हैं, but पहले basic situation आपने खुद करनी है. So over here we are not giving the magnesium sulfate only for neuroprotection. We are giving for prevention of eclampsia. So that is why it is very well indicated over here. What else are you going to do? You are going to catheterize the patient. Catheterize actually आपके antihypertensive anticonvulsant से पहले ही हो जाना चाहिए था. 3-4 चीजें जो होनी चाहिए थी जिसमें IV line थी. Starting low dose Windows lactate. ठीक है. उसके अलावा catheterizing the patient and maintaining intake output record. CTG भी हो सकता है, लेकिन उसके बाद जो है वो आपने उसको करना है antihypertensive and anticonvulsant. उसके बाद आपने CTG करनी है, जो कि उसके बाद next उस पे आती है. और क्या करना है? What else do you need to do? You need to give
cover for the baby.
You need to give a steroid cover for the baby. So dexamethasone or betamethasone should be given. Doppler has some emergency. I don't think there is time, but yes, if you can get it done, that's good. What do you expect the bishop score to be at 33 weeks? It's going to be poor. Blood sugar, I agree with you. So हमने कर लिया, हमने blood sugar monitor कर ली, हमने blood pressure को antihypertensive देके control कर लिया. Now what? Yes, I agree with you. We need blood sugar level before we give steroid, because with steroid you have to, when you are going to give a steroid, you will increase the dose. If your patient is taking insulin, तो आप insulin की dose बढ़ाएंगे. अगर patient insulin नहीं ले रही, तो आप add कर सकते हैं insulin for the time for 3 days from the injection. ठीक है? अच्छा जी. और what else? Does you have become very quiet? Just बता दो. आप तो हो गया. 33 weeks पे patient है, दोबारा बता रही हूँ. 160, 110 है. Labetalol आपने दिया. The blood pressure is better. The blurring of vision is still there. More in one eye and less in the other eye. My question is, what are you going to do?
Also check the labs.
आपने labs check कर ली. Labs में uric acid जो है वो 8. आगे चलें next time. Okay. So her urinary protein is 3+, her platelets are 151, hemoglobin is 14. Ultrasound shows absent diastolic flow in a 1.4 kilogram baby, and fundoscopy shows changes of hypertension. इसमें uric acid कर लो 8. ये आपके पास available है.
As the mother has become stable now, then we will
Symptoms.
check the symptoms.
The blurring is still there. The blood pressure is a little bit better, but when you stop giving medication, it comes back.
Prepare for emergency cesarean.
Okay.
Plan.
Should we plan her delivery? I agree with you. Why do you want to plan her delivery? What is there that makes you think a delivery plan?
Urinary protein is very high.
Excuse me, madam.
Yes, we should absent diastolic
We
flow.
should involve a senior pediatrician.
Madam, we should prolong the pregnancy because
Absent diastolic flow.
the ultrasound Doppler is shows absent diastolic flow.
So that is exactly my question to you. कि अगर absent diastolic flow है तो should you deliver or not?
No, madam, it can be prolonged for 4 weeks to prolong the pregnancy for 4 weeks.
Symptoms are not.
What about the patient's blurring of vision?
That indicates imminent eclampsia.
Actually, to my understanding, the patient has got imminent eclampsia. So in a patient with imminent eclampsia, even if the diastolic flow would not have been absent, you would have planned a delivery. So my advice is that after counseling of the patient, you should plan delivery of the patient. So the question is, ये हमारी actual patient थी, and when we gave her the betalol, we gave her the nifedipine, we gave her the betalol, and we gave her hydralazine, her blood pressure did not improve. So what should we do? Uric acid is 8. Deliver how?
Emergency
delivery.
Cesarean section.
Should you go for induction of labor in this patient?
No, that will prolong the case and
No.
कोई ऐसा चाह जो vaginal delivery करना चाहे?
No, madam, it gives a stress to the fetus, and the cortisol levels are increased in the circulation. That's why the baby is low
Bishop's score is
birth
poor.
weight and low gestational
Bishop's
age.
score is already poor, so we want to plan delivery. What are the precautions at delivery that you want to do? क्या arrangement करना है delivery के लिए?
Availability of good nursery care and nursery ICU for the baby.
Okay.
Senior pediatrician should be involved.
Right.
Family should be well counseled
Yes.
regarding the outcome of the baby.
How will you ensure safety for the patient? आपके जो आजकल talks आ रहे हैं उसमें there are 4 components of talks. Patient information है उसके अंदर information gathering है, counseling है, patient safety है. So कैसे safety ensure करोगे? WHO safety checklist is okay, but what about this particular patient? WHO safety checklist आप हर एक में apply करते हो. इस patient में क्या risk है and how will you prevent those risks?
Bleeding के लिए blood arrangement हमारे पास इसको देखेंगे और
Risk of going into PTH.
Why is the risk of going into PTH? वो तो risk correct बोलते हैं. इस patient को क्यों? Question for everyone.
Risk of eclampsia.
There is risk of eclampsia.
Ma'am, risk of pulmonary edema, so fluid restriction up to 80 ml per minute per hour.
What else is the risk?
CVA, cardiovascular accident.
So इसको कैसे prevent करोगे?
To control the blood pressure by
Madam,
labetalol and
give it a
Control
hydralazine.
the blood pressure. How will you control
Yes.
the blood pressure?
By monitoring every 15 minutes and with hydralazine and
Control the
labetalol,
blood
whichever is available.
Do you want to talk about the type of anesthesia?
Yes, general anesthesia.
Will that control the blood pressure?
Yes.
That will keep the blood pressure down. What is the risk of general anesthesia in this patient?
It will aggravate the
Stress,
hypertension
madam,
when you intubate a
कौन सा
patient.
stress?
Intubation, during intubation.
Intubation में क्या होता है?
एडिमा की वजह से डिफिकल्ट इंट्यूबेशन होगी.
It causes the laryngeal spasm and increases the blood pressure.
So when the patient is intubated, the vocal cords can get irritated. There can be laryngeal spasm. There can be a transient rise in blood pressure, which is dangerous for this particular patient. So for this particular patient, the lethal block is much better, like epidural or spinal, which will protect the patient. So जब आप patient safety की बात करते हैं, पहली बात ये कि आपके पास best team available होनी चाहिए of the anesthetist and also of the pediatrician. And sometimes you might want to have a cardiologist with you if a blood pressure is not controlling. For this particular patient, हमारा 120, 110 diastolic से नीचे आ ही नहीं रहा था. So we also called the cardiologist to make sure that the blood pressure remains under control. So this is the first step to patient safety that you're going to do. The second step to patient safety that you're going to do is the type of anesthesia that you're going to give. The third step of patient safety is the limitation of fluid to 80 ml to actually less than 80 ml per hour, so to give minimal fluids to the patient. And the last thing that you're going to do for patient safety is that you're going to ensure that the baseline coagulation profile, because the coagulation profile might be disturbed and you have to ensure that coagulability is okay. I will repeat, for patient safety, first of all, your team should be okay. The team should consist of a senior anesthetist, a senior pediatrician, and sometimes a cardiologist as well. But most of the time, an anesthetist and a senior pediatrician is good enough for you. And maybe an ICU specialist. The second thing is that you have to choose the type of anesthesia which is going to protect the patient, which in this case is going to be lethal anesthesia. The third thing for patient safety is that you're going to limit the fluids that you're giving to the patient to less than 80 ml per hour because there is risk of pulmonary edema. और चौथी चीज आपको मैंने कही थी वो ये कही थी कि आपके पेशेंट की बाद में आईसीयू केयर की जरूरत होगी. ये पॉइंट्स लिखते था कोई ना कोई लिख देना. Okay, so these are the 4 things that you need to do to ensure. What else? Risk of CBA की हमने बात की थी, उसके लिए हमने कहा था that the blood pressure should be kept low. When I was working in Lahore General Hospital, तो वहाँ एक मुझे थी, वो लोग हर पेशेंट का जो eclampsia वाली आती थी, they would do a CT scan, and they would find yes a multidisciplinary team IMD, and with CT scan they would find that a large number of women who presented with eclampsia actually had a separate hemorrhage system, and that was the reason for the increased number of deaths at that point in time. So बाकी जगहों पे मैंने नहीं देखी, but it's a good idea to do a CT scan if the clamp infection है. और कोई बात इसमें कहना चाहोगे? So once the baby is delivered, what do you want to do? Are there any? मैंने बात करके, are there any risk to the baby from the perspective of diabetes? So when you counsel, because there is delayed lung maturity in diabetes. So when you counsel the family, you must also tell them कि ये कहने को तो 33+ weeks है, but इसका behavior जो है would be even that of a younger premature baby. What else do you want to do? Post delivery, what do you want to do?
Hypoglycemia. Glucose monitoring of baby.
Early cord clamping नहीं करनी. Cord clamping delayed होनी चाहिए. You are going to monitor the blood sugar of the baby. What else? Surfactant may be required because of prematurity. हमारे बच्चे को लगा था. और क्या होगा?
And IV antibiotics to the baby as well.
Baby will get IV antibiotics. What else?
Watch for fits because of
Watch for the blood
hypoglycemia.
pressure and the blood sugar levels. What else?
Watch for fits.
Watch for fits. तो इसके 24 hours anti-convulsant देना जरूरी है. Agree and maintain the blood pressure. What else?
And magnesium sulfate levels.
Serum magnesium sulfate levels कराएंगे. What else? बहुत ही पॉइंट रह जाने की
There is risk of cerebral edema. Magnesium sulfate and
Mannitol may be required. Other signs of cerebral irritation is so you might give mannitol, and sometimes it is also required when the blood pressure is not being controlled. What else? Potassium level क्यों? I don't know. I have never done a potassium level of this patient. You need to tell you follow up with what else? एक बात आप बता दो तो स्टैंडर्ड की जांच हो.
Start feeding, breastfeeding.
Breastfeeding वो भी ठीक है. What else? अरे लड़कियों कैंगरू मदर केयर 1.4 किलोग्राम प्रीमेच्योर बेबी है, केएफसी करोगे? तुम्हारा सवाल मुझसे ये होना चाहिए माइक्रो फिट पढ़ने वाला केएफसी कैसे होगा? Yes, any other relative can do kangaroo mother care. The baby is a candidate for kangaroo mother care, so the family should be counseled and explain what kangaroo mother care is and how are we going to do that. And the last thing that I want to tell you is that at 6 weeks, glucose tolerance plus her blood pressure should be checked. At 6 weeks, the blood pressure should be checked and the glucose tolerance test should be done to make sure that blood pressure or blood sugar normal is. We are going on to the next slide. इमरान भाई आवाज नहीं आ रही. मेरी तो आ रही है, आपकी बोल ही नहीं रहा. मेरी भी नहीं आ रही.
मैम आ रही है.
आ रही है. Okay. So I will repeat it once again that at 6 weeks of after delivery, the blood pressure monitoring should again be done and the GTT should be done to find out कि blood pressure normal पे आ गया कि नहीं. क्योंकि ये जो होती है इस patient में खास बात की इसकी she was a book patient, she had no history of hypertension, and all of a sudden the blood pressure goes high. So this is something which should be thinking of. एक scenario और कर लेते हैं, पता नहीं क्या है. 9/17.
IUGI भी था और भी वो काफी देर से चल रहा होगा underlying blood pressure.
So that is a possibility as well. That is a possibility कि blood pressure check करने में miss हुआ है. ये mic close कर. तो बात मत देखिए दोबारा ऑन करो. वो क्लोज कुछ और कहेंगे. मैं भी दे दो क्लोज हो सकता है. Girls, can you hear me? Okay. So any questions? एक क्विक और कर लेते हैं जल्दी से सिनेरियो. I think that's important. करना है हमारे पास. Okay. The scenario is Mrs. SR. अच्छा summarize कौन करे? आप कोई और करे तुम दोनों जाओ. अगले दो लोग आते. I will read it meanwhile. Mrs. Shazia Rana, wife of Mr. Rana Mazhar, 49 years of age, resident of Raqqa town, married for 23 years, separated from husband. Para sweetness management के बाद delivery delay के साथ है. So it is a very, I don't know. तो पिछले केस पे दोबारा जाना चाहती हो? Okay. देखो बात ये है कि in this patient, I don't know why you want to delay the delivery. Even if the blood pressure is controlled, the patient is having blurring of vision. So with blurring of vision, sorry, with blurring of vision, I would not want to wait. Blurring of vision के साथ delivery हो जानी चाहिए थी, इस patient में delivery होनी थी. The only thing if the blood pressure is controlled that you could do was that you could wait for DEXA to take effect. Otherwise, कोई नहीं. Just the lesson. Okay. The next scenario, Mrs. Shazia Rana, 49, added 23 years, separated, para 3+0. Last child born 15 years of age. In which कोई और आने पड़ेगा मेरा गला हो रहा है.
Mrs. Shazia Rana, wife of Mr. Rana Mazhar, 49 years of age, resident of Cobda Town, Lahore, married for 23 years, separated from husband. There are 3+0, 2 male and 1 female child. Last child birth 15 years ago, admitted through emergency department of HLH on 2nd of September 2022 with complaints of heavy menstrual bleeding from 10 months. Watery vaginal discharge from 2 months and severe anemia, HB 5 gram per deciliter, weight 85 pounds. Mrs. Shazia, Mrs. S are 49 years of age, married for 23 years, separated.
It's not important. So when you're giving a summary, you only say those points which are important. Mrs. SR 49 years, age ही होगी. ठीक है. Para 3+0, separated from husband, presented with this.
Mrs. SR 49 years of age, separated from husband, para 3+0, presented with complaints of heavy menstrual bleeding from 10 months, watery vaginal discharge, and severe anemia with weight loss.
Okay. So somebody has made a good point that we should look at the pathway classification and take the history accordingly to find the cause. So in a patient who has been married, who has heavy bleeding for 10 months and a hemoglobin is 5 and weight is 85 pounds, what is the differential diagnosis? Tuberculosis. मैं तो कुछ और सोच. अगर patient को heavy menstrual bleeding हो रही है, weight loss हो रहा है, तो फिर तुम क्या सोचोगे?
Cancer.
Malignancy. कैंसर क्या होता है? Malignancy यार. दिमाग की malignancy है, उसकी वजह से ना उसका weight loss और heavy menstrual bleeding. Endometrial carcinoma. Behave like professionals. You are talking as if you guys are like पता नहीं क्या हो. ये तो जैसे कोई मैं आपको कह नहीं सकती. I know any term use कर रहे हो. The probable diagnosis is endometrial carcinoma because she has got heavy menstrual bleeding, she has got a low hemoglobin, and she has got a weight loss. ठीक है? पहली diagnosis. दूसरी क्या है? What else could have happened with her?
Fibroid.
हाँ, hyperplasia भी हो सकता है. I agree with you. What else? It could be because of a fibroid. It could be DUB. It could be polyp. Yes, I agree with you. It could be polyp.
एग्जाम में अगर हम endometrial CA नंबर 1 पे करेंगे ना तो वो फिर objection होता है कुछ examiners.
बिल्कुल भी नहीं. इसके अंदर endometrial CA should be आप इसको कहने के तरीके से डिफाइन करते हैं. आप जो मर्जी कह सकते हो. कहा आपने कहने पे किसी को इतराज नहीं करता. बात है आपने कहा कैसे. So आपने कहे कि in this particular patient I would like to rule out endometrial malignancy because of the history of this witness. ठीक है. आप rule out करें. आपका diagnosis ये आप rule out करेंगे तो उसके साथ आप कंफर्म भी करेंगे. Polyp is a very good second diagnosis. लेकिन अगर मैंने पॉलिप कहना होगा तो मैं पेशेंट से पूछूंगी कि तुम्हें ये ऑफ एंड ऑन ब्लीडिंग वर्सेस डिस्चार्ज होता है, क्योंकि what we get discharge is actually a good diagnosis mixed with heavy tertiary bleeding for polyp. So I would put a fibroid polyp as number 2. Number 3 कुछ भी हो सकता है, so it could be DUB as well. ठीक है ना? हाँ, यही है बिल्कुल. तो आगे चलो.
difficulty in solving this.
हाँ, मैं अभी वो आ रहा हूँ. अगर स्लाइड बदलनी तो.
Slide नहीं change हो रही.
Right, the slide are clear.
चेक कीजिए.
Okay, now.
Significant 0.17 kg weight loss in 1 year, difficulty in swallowing 1 year, patient is very anxious, depressed and crying, acute psychiatric attack.
So now the thing is more clear क्योंकि आपको अपनी differential diagnosis बनाने में आसानी होगी, क्योंकि उन्होंने बता दिया कि weight loss की 2 वजूहात नजर आ रही हैं. One difficulty in swallowing and the other is that the patient was very anxious, so probably she was not even eating. So that is why. So this basis पे probably it might not be a malignancy, but it still could be. Her hemoglobin was 5 grams per deciliter, and there was a submucous fibroid which was displacing the endometrium, and I think it was 5 to 6 centimeter in size. Now this is your patient. Cervical cancer can be together, but what is it that you are suspecting cervical cancer?
Watery vagina fistula.
Okay, ठीक है, that could be a diagnosis. There's nothing wrong with that. अभी इस पे जो important बात नहीं बताई हुई, pelvic findings भी नहीं बताई हुई. So the cervix was normal looking, and the uterus was about 8 to 10 weeks in size. चलो आगे चलो. इसमें और कुछ किया? फिर बस. Okay. So what are you going to do? Sir आ गए. अस्सलाम वालेकुम sir.
गुड मॉर्निंग मैडम.
कैसे हैं आप? ठीक ठाक हैं?
बस आपकी आवाज सुन के ठीक हो जाता.
I'm so glad अभी आपके आवाज सुन के ठीक हो गए sir. So we were discussing a woman who had presented to us with heavy menstrual bleeding, weight loss of 17 kilogram in a year, and she was very anxious and depressed, and difficulty in swallowing for a year. For anemia, we have 5 gram hemoglobin. So what we will do is, I think we will leave it here, and we will discuss it the next time when I come. We will start from here. मेरे ख्याल में सर की क्लास है, सर को मौका दें इसमें, क्योंकि मैंने केस सिनेरियो बनाना है, बढ़ाना है इसके ऊपर. So it will take about 40 minutes to discuss this. So sir, I'll stop here and hand it over to you, and we will come back and start from here. Okay.
Thank you, ma'am.
Thank you.
कैसी हो रुबीना?